Thank you so much for your patience. Good morning. I'm San Francisco Mayor London Breed. I'm here with Dr. Grant Colfax of the Department of Public Health just to give an update on what's happening with the Omicron variant, because I know many of us are anxious to know, when is this thing going to start dying down? Well, the good news is things are starting to plateau. It doesn't mean that we get super comfortable and take our guard down, but even though we are still seeing additional cases, even though our hospitalizations are very high, we have the capacity to handle what is coming our way. We are starting to see just the numbers plateau, and the trends from other parts of the country and the world show the people that were pretty much ahead of us, and the case were skyrocketing. We are paying very close attention, and it seems like San Francisco luckily is behind all of that, and so we are following a very similar pattern to other cities across this country. So if that's any indication, and plus with San Franciscans being 82% vaccinated fully, it's really, hopeful for the future, and hopeful that we will continue to move forward. We will see some additional improvements as the days go on. And I know that it's been a very, very challenging couple of weeks over the holiday season. But as we continue to say, one of the most consistent things that have been said time and time again throughout the course of this pretty much 2-year pandemic is that the light at the end of the tunnel is here. We may go through another tunnel again, but just know that there is hope and there is light. And so I'm here just to also say, because I know that many people, are asking a lot of questions. Well, what's going on with testing? What's going on with the Tenderloin emergency plan? Why are things not moving as quickly? And many of us should understand the city and its bureaucracy, despite an emergency declaration, it's challenging. But more importantly, let's keep in mind that we see these numbers of the Omicron variant spike. We also see them spike with our city employees. A lot of our police officers, our firefighters, our Muni drivers, our Department of Public Health workers, and those at San Francisco General are out with Omicron. So we're going to continue to experience this challenge for some time. So we ask for people to be very patient with us, to know that we're doing our very best. We're working to backfill sometimes some of those positions when they're out with overtime and a number of other resources, but these are the times that we are living in, and as a result, we just have to adjust to our environment. So with that, to talk more specifically about where we are with Omicron, what we can hopefully expect for the future, and the hopefulness, when Dr. Colfax is smiling and excited and hopeful and is giving an indication that things are going to get better, then I know that's probably actually what's going to happen. So it means we get to come outside and play, right, Dr. Colfax? All right, so ladies and gentlemen, please welcome to give an update on our COVID-19 Omicron variant and what's happening throughout San Francisco now and hopefully into the future, Dr. Grant Colfax.
Good morning, everybody, and thank you, Mayor Breed, for your ongoing leadership as we enter the third year of this pandemic, third year. And as the mayor has stated, we are indeed seeing COVID-19 cases drop relatively rapidly in the city. And we can now confidently say that we are on the beginning of a downward trajectory with regard to this surge. Our latest data show that our cases peaked on January 9th with a 7-day average of 2,164 cases per day and have steadily dropped each day since then to 1,076 cases per day on January 12th. This is good news. It's been a rocky start to 2022, but I ask that we all hang in there for just a little bit longer. The surge is not over yet. Hospitalizations, which trail the peak in cases, will still continue to go up. Fortunately, for now, we expect to meet capacity within the healthcare system to take care of people both with COVID and with other healthcare needs in our hospitals. We are urging people to remain particularly vigilant for a little bit longer. Cases are still very high. Cases are indeed still very high, especially compared to prior surges, and we all need to get well past this peak. And look, I know that everybody is exhausted. Let's give some gratitude to our frontline staff who, as the mayor has said, have been working overtime to patch together coverage as colleagues become infected and had to stay home. Many of them became infected too. And fortunately for the vast majority of our cases in the city, cases have been mild because people were fully vaccinated with the first series, and for many people were up to date on their vaccinations with regard to the boosters. At this point, it looks good with regard to making it through. We are likely to make it through this surge and come out in a much better place. And I think it's important to emphasize, with the case rates so high and what we're seeing across the country, across the state and locally, that we are in such a far different place than we were a year ago with our prior surge. We are getting through Omicron, the most transmissible variant yet. Remember, this variant is so much more transmissible than that Alpha, than the Delta, the things that we were dealing with before. And yet we've managed to keep our hospitals, our clinics, and other essential services open. Most cases have been mild or asymptomatic, especially, again, for those who are up to date on their vaccinations, especially for those who get a booster. We've proven that COVID doesn't have to upend our lives, even if we have to be vigilant, smart, and flexible to adapt to what's needed and when it's needed. And as your public health department, I want to stress that now our goal is not to prevent every case of COVID. Omicron has proved that that's simply not possible. Our goal is to prevent the worst outcomes: severe disease, hospitalizations, and death. And with regard to that, I just want to ground ourselves in comparison to last year. Last year, we lost 165 San Franciscans to COVID in January of 2021. This month, to date, we have lost 5. Now, we don't know what COVID has in store for us, but we do have great defenses against this virus: our vaccinations and our boosters, and I expect in the relatively near future, effective antiviral medications. And we know how to layer our defenses, like during periods of now with high transmission, when we must protect our frontline workers and the most vulnerable among us by masking, testing, improving ventilation, and of course, staying home when sick. Omicron has taught us that we have vulnerabilities in our system of care. We certainly need testing to be accessible, affordable, and fast so that we can truly use this tool to gather safely. We are working with our state and federal partners to make rapid over-the-counter tests easy to come by, and are requiring our healthcare system partners to step up and do their part with regard to testing, just as they've done with hospitalizations. We also anticipate important new tools to become increasingly available soon, such as those retroviral medications. This will allow us to better protect people who are especially vulnerable to severe disease. As we come out of Omicron and cases drop, we will follow the data and science and begin to drop restrictions when and where they make sense. And we acknowledge that individuals have different levels of comfort with the risk of COVID, and that indeed different levels of risk because of certain medical conditions. Your risk assessment may vary, and what you're willing to do with yourself, your family, may change depending on your own risk assessment. Individuals will want to adapt their responses to their own risk and comfort levels within the conditions stipulated under our health orders. We ask that San Franciscans be tolerant and supportive of each other's needs and work together to make each other feel comfortable and supported. And while it is certainly possible and plausible that we will be dealing with other variants in the future, hopefully we will be able to situate COVID among the many other infectious diseases and health conditions we have to contend with, smartly, but not letting them upend our lives. San Francisco, thank you for all you've done and continue to do as a city, and we will continue to get through this together. Thank you. Questions?
So I'm a little confused, doctor, and forgive my ignorance. So you're saying that the cases are beginning to fall rapidly, a downward turn, but then you say the surge is not over.
Well, yeah, I mean, the cases are still high. So I guess it depends. If you define surge as a straight trajectory up, but we're still in the surge. I mean, our cases are still much higher than they've ever been before. So I just want to make sure that people understand that we're not out of the woods yet. And our cases are still extremely high, but the good news is they have plateaued and are starting to go down. But they're still at a relatively high level than where we've been. But as the mayor said, we're looking at data from other places that have been ahead of us, and the consistent data seem to show that cases could go up very fast, they start to come down very fast, so we're on that downward trend now. Now, they could go back up again. We're hopeful that that's not the case, but given where we've been for over 2 years now, I think the point is that cases are starting to come down. Hospitalizations are still going up to some degree, but the rate of increase is starting to slow down a bit. And the really important news is that our hospital capacity still remains relatively robust. So we still have capacity to take care of people, whether they have COVID or other medical conditions in our hospital system. And remember, that is such a key metric going forward.
You mentioned possibly dropping restrictions. What type of restrictions are you talking about, and are they going to be based on case rate or hospitalizations?
Well, so it will be a combination of factors that we're looking at, and I think it's too premature to speculate on exactly the order that restrictions would be lifted. But I think we would look at similar processes by which we lifted restrictions after the prior surges. Well, it's the things that the layered defenses that we've required. So I think that, for instance, we've had the indoor masking requirement went back into place. So that is something that we would be looking at in other similar restrictions. But again, I don't want us to jump too far ahead. We're still at very high rates. The hospitalizations are still going up. They're going to level off, we expect, relatively soon. But I think the really important thing is, after being through a number of these surges now, we also want to be responsive in a way that reflects the fact that we need to learn to live with this virus. So we're not going to hold on to restrictions and just waiting for Omicron to go away or COVID to go away. It's clear that that's not going to happen anymore. We will reach a place where COVID is endemic, and we're going to learn to live with this virus, and our lifting of restrictions in a gradual way will reflect that new reality. So again, I refer you to the healthcare orders with regard to where people are required to have boosters. Our point is that really Omicron has shown that people need to be up to date on their vaccinations in order to be as protected as possible from Omicron with regard to severe disease and hospitalizations, which again is our goal here. So getting people, having people access to boosters is really key. I think one of the reasons that we have been so successful with dealing with the Omicron surge is because we have a very high booster rate. 61% of people vaccinated in the city have received a booster and are up to date on their vaccinations. That is far higher than, for instance, the national average or even the state average. But we really want to encourage people to continue to get those boosters, and we're making boosters available both within our healthcare systems, including the health department, and of course with our pharmacy partners.
It is clearly important that we have testing capabilities throughout San Francisco that people can trust. And unfortunately, we've had some challenges with some bad operators, and I really applaud the City Attorney's Office and our City Attorney, David Chu, for taking this action and paying very close attention to the challenges that could arise as a result of people taking this situation for granted. Well, it's not unchecked power for the police department. The fact is, we want to address the challenges of crime in our city. And in fact, everyone nowadays is carrying around all of these gadgets and phones and in someone's face out in the public, and anyone who's not law enforcement can see everything that's going on. People from all over the city. And when you talk about a situation, for example, like with what happened in Union Square, the fact that there was a lot of online chatter, the fact that our officers were aware and needed another resource through video to observe the behavior, and because of our ordinance could not. There are a lot of things that could have been prevented based on information that we get, and we're not only asking to allow this to happen based on evidence, but part of my ordinance is to say we have to also report this information, like when this is accessed by the San Francisco Police Department, it will be made public, it will be provided to the Board of Supervisors, and so if there is a need to do an investigation or anything about why they chose to do it and it's wasn't necessary, then that will be dealt with. But ultimately, the goal is to address public safety. And the fact is, we need this tool. It's a responsible use of this tool in order to do so. My response is that the voters will decide, because we're talking about the fact that, we have major challenges with public safety. And when I say public safety, it's not just really about theft. It's also about assault and the number of people who've been attacked on our streets, the number of people who've been robbed and assaulted. And we want to make sure that we are using every tool at our disposal responsibly to keep the people of San Francisco safe. And I don't think what I'm proposing in my ordinance is unreasonable in light of everything that's been happening in San Francisco.
Mayor, the voters of San Francisco support your ordinance.
Thank you.
Go forward with it. We need the protection.
Thank you very much. From the mouths of citizens. All right. Everyone's had a lousy Christmas.
What words do you have for them? Are some of the restrictions going to be lifted?
My hope is that, yes, as Dr. Grant Colfax said, we use in this entire, we also have a responsibility to follow the state orders, but mostly when we look at the data, when we look at the hospitalization rates, when we look at the number of people who sadly, passed away, it makes it possible for us to potentially remove a significant number of restrictions. But I think ultimately, regardless of the restrictions, that's not probably what's keeping people away from these places. It's really not wanting to contract Omicron. I know that's really what people are focused on is keeping their distance to not get it, but it's highly infectious. It's been very challenging. People are getting it, and the good news is that people, for the most part, are not ending up in the hospitals and dying in numbers like we've experienced just this last year before we had access to a vaccine. So I'm hopeful and optimistic about what this means for the future. And sadly, so many of our small businesses, so many of our restaurants, so many of our families and people who have not been able to get together as a result of this, it's been very, very challenging. And my hope is that as we begin to reopen, as we see the numbers decline, that we continue to be careful, but we continue to go out and support our restaurants, that we order and pick up from our restaurants and our various businesses, that we support our small businesses, because it's going to take all of us to get through this. And part of that is San Franciscans doing a little bit more to support especially those businesses in our community. And I'll give you a perfect example. Like my dry cleaner, I've been going to the same dry cleaner I've had since, I had a dry cleaner. And I'm not getting as many clothes dry clean as I was before. And so just really talking to the dry cleaner that I go to find out how can I, as a customer, longtime customer, be supportive. And so sometimes donations are helpful to the businesses that you care about and support in that way. All right. Thank you very much, everyone.
Thank you, Mayor. Thank you, Mayor.
All right. Thanks, Doctor.